How do you test vestibular function? Have you ever wondered how we can check if our balance system is working properly? Testing vestibular function is all about understanding how the inner ear and brain work together to help us stay upright and oriented in space. This is especially important for individuals with Autism Spectrum Disorder, where sensory processing differences can affect balance and coordination. The vestibular system, located in the inner ear, plays a key role in sensing movement and head position. When this system does not function well, it can lead to dizziness, unsteadiness, and difficulties with movement. For those with Autism Spectrum Disorder, vestibular issues can contribute to challenges with posture and walking. There are several tests that can help assess vestibular function. Each test focuses on different aspects of the vestibular system and can be tailored for children or individuals with sensory sensitivities. One common test is the video head impulse test. This test checks how well the eyes and inner ear work together by measuring eye movements while the head is moved quickly. It is non-invasive and often well tolerated by children, making it a great option for those with Autism Spectrum Disorder. Another test is called Vestibular Evoked Myogenic Potentials. This test measures muscle responses in the neck or eye muscles after a sound or vibration is applied. It helps assess the function of the otolith organs, which are responsible for sensing head position and movement. The cervical version of this test is frequently used and works well alongside other vestibular assessments. Videonystagmography is another important test. It records eye movements using special goggles equipped with cameras. This helps detect abnormal eye movements that may indicate vestibular problems. It can be particularly useful for identifying nystagmus, which is an involuntary movement of the eyes. The Rotary Chair Test is also valuable. In this test, the individual sits in a chair that rotates at various speeds while their eye movements are monitored. This provides insight into how the vestibular system responds to movement and can help identify specific disorders. Lastly, there is posturography, which measures balance and postural control. In this test, the person stands on a platform that can move or change the support surface. This helps identify balance issues, which can be particularly useful for children with Autism Spectrum Disorder who may experience postural instability. Testing vestibular function is important for children with Autism Spectrum Disorder because sensory processing differences can significantly impact balance and coordination. Identifying vestibular dysfunction can guide therapy and support strategies. Sensory integration therapy often includes vestibular activities like swinging, spinning, or rocking, which help children better process movement and balance information. When testing vestibular function in children with Autism Spectrum Disorder, it may be necessary to make some adjustments. Allowing extra time, using visual supports, or providing breaks can help reduce sensory overload during the testing process. The results from these tests can inform individualized therapy plans and improve outcomes for children facing sensory processing challenges. Understanding how to test vestibular function is a key step in supporting individuals with Autism Spectrum Disorder who experience sensory processing issues. This approach helps tailor interventions to improve balance, coordination, and overall sensory integration.